Good morning, everyone. We want to thank you for joining us today. My name is Rachel DeGrand, and I help coordinate the webinars for Hausmann Johnson Insurance, the Benefit Services Group, and BSG Analytics. I want to welcome you to today's webinar, COVID-19 Impact on Employer Health Plan Cost. This is an encore of a webinar we hosted on Tuesday, so if you did join us before, this content will be very similar. I do just have a few housekeeping items before we get started. This webinar is interactive and will feature a question and answer session. You can type a question into the questions feature and we will address it after the presentation portion. Once the webinar concludes, there will be a short questionnaire to fill out with your contact information if you would like our team to run the COVID-19 calculator for your organization. This webinar will be recorded and will be available on the webinar archive section of our website. Each attendee will receive a follow-up email with a link to the recording and the presentation slides. Now, before I introduce our presenters, we do have two short poll questions we're hoping you could answer so we can tailor this presentation to our audience. I'm going to go ahead and launch the first poll now. And the question is your organization's health plan self-funded or fully insured? If you could go ahead and take a few moments to answer. We'll give you a little while here to get your answers in. Okay, thank you everyone for filling that out. Looks like we have about 3/4 fully insured and 1/4 self-funded. Thank you for answering that poll question. And I'm going to launch our second one now. And this one is, how many employees are on your health plan? If you could take a few moments to fill out the answer here, we'd appreciate it. Okay, I'll give you a few more moments here before I close the poll. And here are the results. We have about 7% less than 50, 36% 50 to 150, 29% 151 to 500, and so on. Thank you so much for filling out those polls. We really appreciate it. And we are going to go ahead and introduce you to our practice leader of employee benefits, Tom Yach. Good morning, Tom.
Morning, Rachel. Thank you. And I'd like to welcome all of you to our webcast on the COVID-19 pandemic. I'm really excited to be here with you guys because mainly it allows me to get out of the house, and with appropriate social distancing, I get to see a few of my coworkers as well. So I hope all of you are well and surviving the quarantine situation. And if you have kids, hope you are surviving that as well. Being in the same place 24/7, I know it can be challenging for a lot of us, but hopefully you're doing well with that. As Rachel advised, we'd love to see that information that you guys just shared. That gives us a little opportunity to tailor some of the questions at the end. And I'm also going to try to keep this to about a 20-minute webinar. So if you have more detailed questions, please connect with us after the event. I'm going to be your moderator today. And as was mentioned by Rachel, my name is Tom Yach, and I'm the benefits practice leader here at the Benefit Services Group, otherwise known as BSG. And I am joined by Jessie Popp, who's one of our data scientists at BSG Analytics. And yes, she is actually a data scientist. So I'd like to introduce Jessie and let her get started with a brief overview of BSGA and how our calculator was designed. Jessie.
Hello, my name is Jessie Popp, and I'm a data scientist on the BSG Analytics team. I'd like to start by sharing a quick background about the BSGA team and what we do. We are an analytically focused team which integrates healthcare data from carriers, healthcare organizations, hospitals, and employers into actionable work insights with cost driver drill downs and opportunities using applied data science and benchmarking tools. Our goal is to help our clients achieve their goals. I'll turn this over to Tom to talk about the relationship between BSG, and Hausmann Johnson.
Thanks, Jessie. I wanted to give you guys an introduction to our firms, as well as some of the folks on the line may not be familiar with BSG or Hausmann Johnson, and you might be seeing several logos at the bottom of the screen. And although you see 3 different logos, we are all on the same team. So with that, I'd like to give you a short history lesson just to make sure we level set. BSG and Hausmann Johnson came together about 3 years ago to form one of the larger independent consulting firms in Wisconsin. We focus on employers that are looking for a different type of benefit consulting approach to their health plan, and really we gauge ourselves around data science and customer service. Hausmann Johnson's based in Madison, BSG in Pewaukee, and we serve customers all across the state, whether it's the BSG team or the HGI team. We really look to deliver cost containment strategies that are much different than our competition. What does this mean for you? It means out-of-the-box thinking. It means conversations that are informative and also revolve around some information that you may never have seen before or discussed before. So, a question. What kind of information are you guys used to getting from your medical carrier? If you're an insured group, you typically get limited or not a lot of data at all. And if you're self-funded, you're used to getting most of your claims information. And depending on your size, our teams of HJI, BSG, BSGA, I know there's a lot of acronyms there, but we all receive claims data from the carriers that you might work with. And yes, in most cases, if you are large enough, we do receive information from the insured carriers as well. What we do with that information is the difference maker and where our calculator is different. So let's look a little bit at how we develop the calculator itself, and I'll turn that back over to Jesse.
So in response to the COVID-19 pandemic, the BSGA team has developed a customizable COVID-19 cost estimation calculator. The foundation of our calculator is based on the most recent and reputable research-based studies as they are released by the Imperial College in London. With the fluidity of the data being released, the calculator was designed to be easily adjusted and remain relevant and aligned with the latest science-based studies. I'll let Tom talk about how this will impact the health plans in the present and foreseeable future.
Yeah, and I think the thing to point out here is that second bullet point. It's really based on science. It's not transactional data. Transactional data is a lot of times some of the things that we're probably seeing from a carrier. So it's not a generic model where we feel one size fits all. It's based on a wide variety of scientific data, as well as, most importantly, it can be developed around your specific demographics and your employee health conditions. Really feel like that's really important to point out. So, this slide, I think, is really important from a visual standpoint, and the left side of the screen shows what most providers do for data reporting. These are typically one-size-fits-all type of reports. They can tell you how you stack up against common benchmarks and the carrier block of business, but they can't really tell you why. The right column is how our team can take your specific claims data, merge it with our data warehouse, which has over 1 million claims on file, and we can apply tools and risk adjusters and then drill down into the information to answer the why. If you aren't looking at the episode of care cost, you're reviewing transactional data. Now, these results can be impactful, customized strategies based on your data and your information, not just the market averages. We literally can drill into what city, what county you live in or work in, and advise on health conditions of that area. It's really data science. So Jesse, let's talk a little bit about what some of the parameters are on the calculator.
So here we show a high-level overview of the categories which are addressed by the COVID calculator. Using basic employer census data such as gender and age, we can estimate the number of hospitalizations, medical costs, impact on the per employee per year cost, per member per year cost, and estimate the loss of productivity. Cost estimations are done using the BSGA unit price tool, which reflects relevant and local healthcare costs from the Wisconsin-centric BSG book of business. We also include estimates showing the loss of productivity, which can also be adjusted depending on the employee's ability to work from home, as well as the infection rate, which is another easily adjusted variable that we've built into the calculator. With more data sharing from the employer, we have the ability to incorporate risk as it pertains to the employer's population's comorbidities. Just to back up for a second, some examples of comorbidities are chronic illnesses such as asthma, diabetes, or hypertension. Studies have shown that some comorbidities are known to impact the level of care needed for COVID patients. For example, we know that a patient with asthma or high blood pressure over the age of 65 would be more likely to be hospitalized than a 35-year-old without asthma or high blood pressure. With data sharing, we can assess the health of the enrolled employees and members and apply predictive analytics to assess the potential impact which COVID may have to the employer's health plan costs. The ultimate goal of this tool is to help employers prepare for an additional COVID-related health plan costs that are coming on the horizon.
Yeah, that's right, Jesse. And as we've been saying, those specific conditions, those are key components to what you as an employer should be looking for. So all four of these boxes are certainly important in the calculation. We've got a basic tool or a basic model that can give you a great estimate on the cost impact. But if you'd like us to help you further, think of this. We can adjust this model based on demographics and illness burden specific to your company. Again, really important. We also just have the basic model too, which just works off a census count. So either way, we can give you some ideas to where we're going. So before I flip to an example of the calculator, maybe you're sitting there asking yourself, do I have an older population? Do I have a younger demographic? Am I drawing people from an area that is high risk? We may not know some of these things, but maybe you're thinking about your demographics right now and you feel that you might have a younger workforce. That's great. Maybe your group has a higher asthmatic population that isn't defined or isn't identified by most of the calculations out there. If you've got that higher asthmatic situation, your claims will be impacted dramatically, even more with a younger population, and it will cost you more. So how are you reviewing that? My point is, what you may be seeing sent to you is a basic market calculator, but your risk profile will change that based on your current health conditions. We've got the ability to show you what matters and the impact specific to you. I'll also point out that I know that we've got a number of folks on the line that may be in the insured market based on our poll. This can make a difference for you guys as well in the projections, but also can help with some of the renewal conversations with some of the carriers. We can get into that a little bit more in detail because there's some specifics that we should talk about, but please connect with us after to discuss those options. So let's talk about the tool now. Let's look at this thing. And we're going to start off real simple on an insured basis. Let's look at the top and see that we've got in the top gray box up here, we've got an employer of about 125 employees. The top section of our calculator is really the section that we're going to calculate on under the variable assumptions. So you see that the first one is infection rate. That one's a hot topic of conversation, as a few weeks ago, some of the studies were showing a model as much as 60% infection rate. Well, since then, this has come down, and we're being conservative and using three different scenarios of 10, 20, and 30% over to the right here. So we're using three different scenarios to get a gauge of where we might fall. And please keep in mind, anything in this top section can be customized and really modified to your specific situation. So we've got that first line of infection rate. We've got a line that also looks at estimated cost of testing. Again, this has gone from one extreme to another, but we're using a conservative number here as well. Remember, can be modified. We look at members being tested. We look at lost time. We look at the estimated replacement wage, which is targeting potential impact on productivity in the bottom section of our chart, because again, lost time, we may have businesses that some folks can't work at home. So this top section sets us up for the rest of the analysis. Our main focus is going to be this middle section, and in the middle black shaded boxes, which show the impact each scenario would have on your health plan. So those are those black boxes, 10, 20, 30% respectively. Let's stick on the middle box of 20%. So that potential impact of 125 lives at 20% infection rate, the potential impact to the employer is about $85,000 as we guesstimate. We've also broken this down to a per employee per year and a per member per year. And for our clients, we a lot of times look at how much on an annual basis the cost of insurance is running. And our numbers typically run just under $10,000 per year. But regionally, you guys might be seeing somewhere upwards of $12,000 or $14,000 a year. Now add on another $600 to $1,000 per year per employee, and that starts to become a staggering number. The middle section of our calculator is the customization area, where we've got it titled Employer Group Relative Risk. And this is going to be important going forward. So you see we've got a relative comorbidity or health risk at 1.0. That's simply comparing you to the market and if you had all the same health conditions as the market. And now we know that's not the case. Okay, so but for this purpose, we're just leaving everybody the same. This is just showing a variance. Actually, I'm going to back up one, I think. Let's back up one. This is showing a variance of number of employees. So this value, we've increased to 350 employees on the top. We have the same scenario at 10, 20, and 30%. But if we look at that middle section again, we see a dramatically different picture for a little larger employer with a cost of $237,000. And that's not a small number, you know, so we didn't increase the employer size by a lot, but it went up exponentially. Again, this is just based off of census information and keeping that risk factor that you see at the left at 1, which assumes all the health conditions are the same. Super easy to run. Happy to do it for anybody interested. Just let us know after our slideshow here today. Okay. What we're looking to do here is find out what your possible hospitalization rate may be, as well as the impact to your medical costs by looking at these several categories above the center oval. If we're able to get your census information, we can run the calculator pretty easily. If we get your census and if we can get some additional information from either you, the employer, or better yet, a claims feed, and remember, we have availability to get a lot of these feeds from the carriers for you. But if we get these feeds and a bit more information from you, we can look at the impact specific to your stop loss, your self-funded claims factors, or your fully insured renewal premiums. So think of this. You guys just had a spike in claims with this situation. Carriers are going to say that your loss ratio is X. We all know the reason for the jump, but how do you combat this? Especially if you're getting limited or not a lot of information. We've got the ability to help drive that message with a scientific approach and scientific data, not the transactional stuff you might be seeing from some of the carriers. We've got an extreme database at our disposal to refute and explain the potential impact of this situation and how it may impact your claim rates and how it's impacting you and your dollars. Let's look at something a little bit more specific and look at a model where we've got a bit more information from you and maybe a claims feed. With a bit more detailed information, we're now able to drill into some of the specifics that pertain to your group. I'm going to focus on the second half of the page, or the bottom of the page in the red box, and that's really what's changed in this analysis. So I'm going down into the red box to see where the comorbidity risk or the health risk on the left side has changed for this employer. Remember, this was a risk of 1.0 in that basic model that we just went over. We've now gotten more information, and the model has now changed to a 1.43. This is specifically based on knowledge and or claims information that we might get from you and those health conditions associated with the employees under your care. You can see what it does to the estimated total plan costs, again, in the dark section. So we go from $85,000 with a basic census information to $112,000 with a little bit of detail. That's a significant jump for an employer with only 125 employees. If you're a larger employer, think of the exponential change that you might be facing. So what we're trying to say is that what you may be seeing in the market is it's okay, but it might be a one-size-fits-all approach. I'm not sure that we want to accept that. Our data science approach is a proven analytical way to review the data, provide a more precise view of the impact of the disease, not only to this year, but to next. These 4 basic points, although simple, mean the difference in off-the-shelf analysis versus custom modeling to give you a projected, accurate view. This also leads to a discussion on how you may modify your plan in the future. And I don't know that really a lot of people are discussing that at this time, but let's be ahead of the curve instead of reacting. So, in closing, you've got a lot of choices, a lot of resources coming at you in these days, and some of you on the line right now are customers, and we thank you for being that. For a lot of you, you are not a customer yet, but what we're here to say is we are here to help. This is an unprecedented time in our country, and this pandemic has and will be a crushing blow to many of our businesses. If we can help you be better prepared for what's to come, we'd love to do so, regardless if you're a customer or not. So what that means is that what we're talking about today, our analysis, is completely free to anybody interested. Just contact us. We'll do what we can to direct you the best way we can, no strings attached. So I appreciate all your time today. I'll open it up for a few questions and ask Rachel if she can take us home from here.
Sure. Thanks, Tom and Jesse. For our attendees, if you do have any questions, please go ahead and type them into the questions feature. We'll give you a few moments to enter those in. And Tom, we did get a question during the presentation, and I know you just addressed it, but someone had asked how much it costs to run the calculator. So do you want to reiterate that real quick?
Yeah, so regardless if you're a customer or not, we'll run this at no charge. This is a way for us to help, businesses stay on top of this thing and come out of it hopefully in a better spot. So analysis is free of charge.
Thanks, Tom. Another question that just came in, what is the relative age risk factor on the calculator? What does that mean?
I'll let Jesse answer that one.
So the relative age risk, that's a great question. So this calculator was set up and calculated and calibrated using research-based studies which set illness and hospitalization rates which are based on a general population. So the COVID-19 has a disproportionately dangerous risk for older people, especially those over 80 years and older. So the 0.57 relative risk or age risk that you saw in the calculator shows the relative risk of the COVID-19 population as compared to the working population as compared to the general population.
Thanks, Jesse. One more that came in, how long does it take to run the calculator?
From a time perspective, if we get census information, it's pretty immediate. So if anybody gets us or is interested, we can probably get back to you today and or tomorrow. If we're looking for some of those health conditions, depending on your situation, it just might take a little bit longer than that, than instantly plugging it in. But we certainly can walk through that with anybody after the conversation today.
Okay, thanks, Tom. One more that just came in. What is the difference between PEPY and PMPY?
Yeah, so that's an interesting one, and an easy explanation that we typically use is that employees are your staff, so it's the people that you hire. The members are all the belly buttons on the plan. So if you've got a family of 4, those are 4 belly buttons versus just the employee. So simple way to think about it is just members are belly buttons.
Thanks, Tom. All right, if you do have any additional questions, I think they're slowing down now, but please feel free to keep typing them in. If we don't answer them now, we will definitely reach out to you after the presentation to answer them. We want to thank you all for attending today. Please remember there is going to be a short questionnaire that will pop up after this webinar, and you can leave your contact information in there if you do have specific questions or you want our team to run a complimentary calculator for your organization, and we will get in touch with you shortly if you do choose to leave your information. One last reminder that this webinar was recorded and will be available on our webinar archives of our website, and each attendee will receive a follow-up email with a link to the recording and our presentation slides. Thank you again for attending. Thank you to Tom and Jesse and our team for putting this presentation and calculator together. And we hope everyone has a wonderful day. Thank you.